Hi, I'm Susan Morse, Managing Editor for Healthcare Finance News. I am here today with Scherpbier, who is Chair of the HIMSS Physician Committee. That's just one hat he wears. He's also CMIO for the HealthShare Exchange, and I want to talk about that first. What is that, please? Can you tell us your role?
HealthShare Exchange is the Philadelphia Region Health Information Exchange. So it connects all health systems, hospitals, practices, post-acute care facilities, payers, all into one HIE, Health Information Exchange network, sharing data to help improve patient care, to help improve efficiency of care, and also now, during COVID, to help improve the public health response to the COVID pandemic. And so we share data coming from all our participants, all the health systems, and we share the data with the city of Philadelphia, with the state of Pennsylvania, with our surrounding counties, helping them to track the pandemic, to do contact tracing, to do vaccination tracking. So it's interesting how the COVID pandemic has really shown how health information exchanges, as these regional organizations, play such an important role in managing the pandemic and in supporting public health agencies with their data needs. That was the topic for my talk today, and I think that's an important learning that we have had this year.
Yeah, can you say more about your talk today?
Today I talked together with my with another CMO from the Indiana Health Exchange, so we both shared our joint experiences, and our focus was specifically about what's the Health Information Exchange, but now how has that morphed into a really what we call critical infrastructure to public health tracking. Mostly, of course, about COVID, but we're also learning that what we're doing for COVID equally applies to tracking diabetes or heart failure or other public health problems. So it's great that it's not great, but we're learning these lessons today through COVID, but then we're hoping to apply those lessons to other public health challenges.
I take it COVID spurred this.
It did.
Yeah.
It did. It was always there, but COVID spurred it.
Mm-hmm. But what does this information tell physicians and hospitals that they didn't know before?
That's a great question, Susan, and I think it tells us that we need to that there's so many levels of reasons for data sharing. We might initially just think, I'm sharing data because another doctor needs that data. And that's true, right? Another doctor, another nurse, another care team may need that data. That is the primary use for health information exchanges. But now we're learning and discovering that there are bigger aggregate uses for data sharing. That is public health, population health, helping payers and accountable care organizations track the quality of care, track their populations, make sure they identify who needs the care the most. So it's really lifting up health information exchange from a provider-to-provider network to a provider-to-public health and a provider-to-population health network. That's the learning, and I think that clearly was spurred by COVID. But we need to keep going.
Is it able to predict, in other words, the curve of COVID? Is it able to go that far?
Well, in some cases, we can do that. The main purpose, of course, is to track the curve of COVID, and by tracking it, you're already predicting it. And yes, we are seeing that you can be a couple steps ahead of where hospitalizations are and where the bottlenecks in the health systems are. Yeah. Mm-hmm.
Okay. I'd like to switch now to your other hat as Chair of the HIMSS Physician Committee. Can you tell me about that, please?
So HIMSS has a physician committee, which is a wonderful group, 12 physicians in varying positions, most working for very large health systems as CMIOs or CMOs or directors of health information systems. And as a committee, we do a couple things. We help HIMSS as an organization focus on physicians and other clinicians in general and help take the lead. What are the burning topics in the physician committee that HIMSS, with all its participating vendors and organizations and health providers, need to focus on? So as a committee, we focus on clinician burnout. We focus on documentation burden. We focus on what's AI going to do and what should we be tracking today that will be important for the industry to know about AI in our health systems tomorrow. So that committee, we meet once a month and discuss what are the topics that HIMSS needs to focus on to benefit physicians. I also think it's important to have this committee to make HIMSS relevant, not just to CIOs, but also to CMIOs and CNIOs, the Chief Nursing Information Officers, but also beyond that, physicians in their practices. Whether they have a formal role in IT or not, HIMSS needs to be relevant to them, and that's the goal for the HIMSS Physician Committee.
We've heard about burnout because of course, COVID again. When you get this information, when you talk, is there anything you can bring back to the physicians or to the committee that will help with this issue?
Yeah, we talk about this a lot. And yesterday there was a fantastic session in our MDIS symposium about burnout. And one lesson is clear, is there's no going back.
Yeah.
Everybody knows that, and nobody's asking that, right? Nobody's asking, give me my paper chart back. That's not going back. No, I think the answer is how do we improve our current technology, and how do we use technology to make the interaction between the physician and the patient and the electronic health record, how do we make that frictionless? And today, that EHR, that computer, can sometimes be a barrier between the doctor-patient conversation, which causes extra work, extra time, pressure.
Yeah.
The focus needs to be how do we improve our technology and how do we use additional technologies such as voice to text and visual technologies to say how can we remove the friction so that we go back to a seamless patient-to-doctor interaction, but still use the EHR as a recording device, as a decision support device. That's the vision here.
That is.
No going back, but going forward.
I mean, we hear about this all the time. The doctors hate having to sit there and type while they're talking to a patient.
It's not all, right? It's not
all?
The doctors
Okay.
hate. No, but which is also important to learn. Some doctors thrive with this technology, and some struggle. So we need to also study that and say, what makes it difficult for some, but what makes it successful to others? What do they do that makes it work for them? And there are a number of techniques, and there's a lot of studies about that. So we can't say this is bad for everybody, because it isn't. We need to identify where are the successful physicians and how do they interact with their EHRs and how do they make the interaction with their patient work well? And what do we learn from that to help those who struggle and who don't make it work? And sometimes I believe that's a technology change. Sometimes it's a methodology change. It's not a simple problem. It's a multifaceted problem. I think that's why it's important that HIMSS has a physician committee, that we have regular input from doctors from all kinds of organizations into our HIMSS organization.
Okay, any closing thoughts?
My closing thought, it's really exciting to be in person at this meeting.
Yes.
I'm sure you get this feedback from everybody you interview here. I think nobody knows what to expect from this HIMSS meeting. My experience is that it's a very active meeting, lively meeting. There are a lot of people here, and somehow there's a nice spirit here. There's a nice sense, a nice atmosphere. I think people that are here are happy to be here.
They are.
And you can feel that.
Here.
And I think and that's important. Yeah. It's important, so it makes it a fun meeting.
Okay, thank you, Harm. It's been a pleasure.
Susan. Great talking with you.
Thank you.
Yep.